My husband and I are in our third year of recovery, and we are doing doing great in most areas. I still seem to have a mental block when it comes to sexual intimacy. Um, I enjoy growing closer to my husband. I like frequently hugging and kissing, but when it comes to sex itself, I just have a little desire. Our therapist a year ago said it would just take more time to heal. It has been 2 years with little change. Is this simply a lasting effect of betrayal trauma, or do you think I need to seek other help outside? I actually have a couple questions before I can probably answer this more thoroughly. I would first of all recommend just doing a physical, checking your hormone levels, also looking at your stress levels. My experience has been with people who are in high stress over a significant period of time, their sex drive's down. What we would be looking for with your sex drive, if you're wanting it to be closer, he's working recovery, you feel safe with him. And if it's still low, then we're looking more from the biological component of it. However, if you're being sexually intimate and you're having images come into your mind about things of the past, if you find yourself constantly questioning what's he thinking about, what's happening inside of you is you're not present in the sexual experience. You might have had some hormonal changes over time, but you might also be feeling this questioning in your mind. If you're dealing with those questions in your mind, you might have unresolved questions that are really hindering your ability to enjoy sexual intimacy. If you're stuck in those types of questions, those are things that your therapist said would heal with time. That's not always true. Time does not always heal wounds. Dealing with the wounds, and what I refer to as the fracture of that wound, is what actually helps us solve it. So that would be understanding what's going through your mind and helping you work through that as you approach sexual intimacy. Now, I could probably do a few hours of discussion on sexual intimacy as it relates with couples healing. Obviously, I don't have time to do that, but that's where I would start. I would ask yourself those two questions. Is this more biological? Can I feel that? I mean, do I have sexual drives? And the way you would know is typically when you're ovulating, does my sexual desire go up, or am I pretty low flatline? And that's not uncommon. But is that a part of it for me, which could be hormonal? The other part of it is what's going through my mind as we approach sexual intimacy. Am I feeling the fear, apprehension, worry, or not? And so those are a couple of questions I would like for you to think about as you try to address this. The fact that you're willing to talk about that and explore it tells me that you would like to have a better intimate relationship, but right now it's just not there. You don't feel it. Okay, that's where you're at right now. But is there something holding you back? And if there is something holding you back, I would strongly recommend identifying it, whatever that it is, and trying to resolve it. That may need a little bit more therapy. It might mean that there's some hormones that they're low that might need to be addressed. And if that's the case, then it's over time observing. The other question, maybe a little bit deeper, is do you trust your husband? Is he developing the trust? Are his behaviors showing that he's trustworthy now more so than in the past? Those are the things that I would be looking for. Is do I feel safe, and do I feel like I can trust him? Anyway, those are a few questions that I would have you ask yourself. It's kind of hard for me to give you more in depth than that.